Hello, my name's Tim and I'm one of the physios at the Chichester Physio Clinic based in Bosham. One of the conditions we often see are patients complaining of forearm pain and tension as well as elbow pain, either on the inside or outside aspect of their elbow. Commonly known as either golfer's or tennis elbow, these type of symptoms are normally associated with activities that involve a lot of repeated twisting and gripping. Of course, one of the easiest ways to try and ease those symptoms is to stop the activity that's aggravating it. But if you're a keen tennis player, for example, you want to carry on playing tennis, it might be worth seeking some advice from one of the tennis professionals or the pro shop with regards to how you might be gripping the racket and or the size of the handle of the tennis racket itself. But I wanted to highlight some simple stretches and activities or exercises you could do when you're at home to try and see if you can alleviate these symptoms as quickly as you possibly can. Although the symptoms are obviously in the forearm and the elbow, often these symptoms are associated with issues a bit higher up around your neck and upper back. So there's a really nice simple stretch you could do that helps to loosen up your neck and upper back. And I recommend this for lots of different problems that people might have with the upper limb. All you need to do is find a nice flat surface, and then stand with your heels against the wall, bum and shoulders against the wall, and then can you bring your shoulders and neck back to touch the wall. Can you hold that then for 5-10 seconds. It's actually quite hard to do. If it is sore and painful, then you might want to try thinking about just stepping a little bit further away with your heels from the wall. But ultimately, that's a really good stretch for your upper back, which can help ease some of the symptoms that go down into the arm. To really try and hit the deep muscles of your forearm, there's a really good stretch as well I like to encourage people to do. Start with your palm facing forward and your arm down by your side. Roll your arm inwards and then bring your fingers up behind you so you're stretching through your wrist. You'll start to feel the stretch through here straight away. Really curl your fingers round, and then from there, keep it nice and upright. Can you gently bring your arm out to the side as far as you can, and then back down again. As you bring your arm up to the side, you should feel that tension building in your forearm. Gently up and down like this, and again, no sharp stabbing pain, but the more you go up and down, feel the stretch through that forearm. Should you get any increase in nasty symptoms, certainly either any numbness or tingling or pins and needles, just don't push it that far, just back off, but certainly carry on with doing the stretch. Maybe you can only go this far, okay? That's better than doing nothing, but gradually can you slowly try and increase that stretch. That's really good for the deep muscles through your forearm. And finally, as far as kind of manual therapy for your forearm, the other main way of getting going is just getting stuck in with your fingers and thumbs into your forearm. I like to use, when I'm massaging into tissues, this cream called Physio cream, which is basically natural anti-inflammatories that are really good at helping to calm down angry muscles and nerves. Using the Physio cream, get working into the fingers, with your fingers into your forearm muscles, finding the tender points, working around, up and down, across, in with your thumbs, up and down, working into the area. This can be really quite painful, but nevertheless keep persevering with it, because certainly the more you can get stuck in loosening it up, then that'll get a lot easier. Plus the stretches we showed you already, keep going with these exercises to loosen up your forearm. So by combining rest and thinking about changing how you grip or hold a racket, combined with doing the stretches and the massages that we've highlighted, you should find the symptoms start to ease. However, if you find they're persistent and not really changing as you anticipate, you could always contact us here at the clinic, where one of our great therapists can help try to ease the symptoms for you. I hope you found this of some use, and we look forward to seeing you as need be at the clinic as required. All the best. Bye-bye.